Hi, this is Rahul Patwari.
And Shanu Gupta.
And we're going to teach you right now how to use concept maps in order to make illness scripts.
A concept map is a graphical tool for organizing and representing knowledge, in this case based around an illness script.
And so the concepts are usually enclosed in circles or boxes or some sort of shape. And then the relationship between the concepts is indicated by a connecting line between the two concepts.
So we're going to start by doing this with a bunch of cases that we've seen before. We'll be practicing these specifically in your clinical skills session with some of the cases that you've already done some clinical reasoning with.
And so why don't we do one now as an example, and we're going to go back to Nicole McNeil. That was the case from the Foundations course, and that's the little girl who had asthma. Okay, so we're going to start with asthma, and when we start with these concept maps, you're going to put the main concept in the center of the page or the top of the page in the circle. So this one, we're going to use asthma.
So typically when I think about a disease, I think about it from probably these 6 different perspectives. What are the risk factors involved? What is the pathophysiology that's causing this disease? What kinds of things I can expect to see on the history? What might I be looking for? What might I find on physical exam? What are some testing modalities that I would use for this? And how am I going to treat it?
All right, so let's start with pathophysiology here. So when I think of the pathophysiology of asthma, I'm thinking of bronchospasm, allergen exposure, and excess mucus production.
Actually, allergen exposure leads to bronchospasm, doesn't it?
Okay, well, then we could just draw a line from here to here, and we can actually label it with leads to. Oh, actually, we forgot to do risk factors, so let's go over there. So for risk factors, the things I would think of are there's genetic predisposition. Some people, it runs in families. Smoking, pet dander, and other environmental things. And in fact, environmental things, pet dander is an environmental one, and so is smoking.
And now let's move on to the history. So asthma presents with usually shortness of breath, chest tightness. Patients might hear themselves wheezing. There's usually an exposure to particular triggers.
Like what?
Most commonly in young kids, I would say exercise.
Okay, we can put that in here too. Exercise is one of the triggers. And now we're going to move on to the physical exam.
On exam, I would be, of course, listening for wheezing. I might expect to see tachypnea or a fast respiratory rate. Sometimes we see them tripoding, in particular when they're trying to get extra air into their lungs. An inability to complete sentences often tells me about how severe their asthma attack is, and accessory muscle use.
And is there anything that you would look for on testing?
So things that I might look for in testing, one would be a peak flow, which is a great way of measuring the amount of air that's being moved in their lungs. And I know you'll be learning a little bit more about this later on in the next block.
Yeah, so it's basically the amount of how much air you can blow out in one breath, like fast like that.
Exactly. The next is chest x-ray. You don't always see something on chest x-ray with asthma, but sometimes you might see things that may have triggered the asthma, like an infection, so maybe a pneumonia. And then arterial blood gases. Do you do arterial blood gases on your patients with asthma?
I usually don't in the emergency room, but it's a good way to kind of judge how well they're oxygenating or how well they're ventilating by measuring their oxygen and their carbon dioxide. And if they're not responding well, you can use that to monitor their treatment.
Certainly, I think if someone is tiring from their asthma attack, that can be a useful measure of what their physiology is doing.
Absolutely. Now, let's move on to treatment. So for treatment, we're usually going to start with bronchodilators, and the common one we use is something called albuterol, which you may have heard of. Oxygen, if they are not able to keep their oxygen level up, we could give them supplemental oxygen. Steroids, usually by mouth. things like prednisone are usually very helpful. They take a while to work, but they are extraordinarily helpful and very important. And there are, of course, many other treatments that we're not going to get into here. And so you can see now we have constructed a concept map of asthma built around an illness script. And so we started in the center with the disease, and then we went through all the components of an illness script, from risk factors, pathophysiology, history, physical exam, testing, and treatment. And we wrote down everything here that we kind of know about it. And along these lines, you can put different relationships like we did here. Allergen exposure leads to bronchospasm. And a lot of times you'll find many different things are going to connect. Like all this stuff here represents shortness of breath, and it might kind of connect with this. And so this is basically how you create a concept map of an illness script.
Now, if you were to look through Miss McNeil's case, you might have thought of other things to add to this, of course. Now, in the clinical skills session that you're going to join us in, we're going to have you do similar concept maps based around 4 diseases that you have already met, 4 patients that you have already met. Each table or each team will create one concept map for one particular disease. Once you are done with your map, we're actually going to have you compare and contrast between your illness scripts as you create them in these concept maps. And I think really the big idea is to help you see how many things interact, even though the diseases are different, and therefore their testing and treatment is different. So really just a way for you to help understand how to differentiate a patient presenting perhaps with something generic like fever.
Okay, thank you very much for watching, and we'll see you next time. Bye.